Welcome back, and this is the second part of malabsorption syndrome. And in this lecture, I talk about the etiology, like what are the causes of the malabsorption. Mostly, there is infection, inflammation, and the trauma, injury, or some surgery like bariatric surgeries. This causes the malabsorption because the villas of the intestine are atrophied in these cases, like inflammation, inflammatory bowel diseases. When there is injured or the damage to the intestine, we see that there is malabsorption of the nutrients. And when there is the prolonged use of the antibiotics like the tetracyclines, this causes the malabsorption as well. So the celiac diseases, there is atrophy of the villi, the Crohn disease, that is the type of the IBD, the chronic pancreatitis, when there is this amylase lipase or these enzymes, and there is also the less trypsins in the chronic pancreatitis, which leads to the malabsorption of fats or cystic fibrosis when there is disorder of the transporters. And we continue to the etiologies like the in the lactose intolerance, we don't have the lactase, so the nutrients of the diet that contains the lactose, they cannot be absorbed or the digested, like mostly the people who don't have the lactase, they don't drink the milk. And certain irregularities like the congenital, or when there is biliary atresia, there is no bile ducts, and so we see that there is no flow of the bile from the liver into the intestine. That's why there is no absorption of the fats. This is the example of the congenital uh, malabsorption, and also we see the acquired malabsorption, like in the Crohn disease. We see in the previous slide that in the celiac disease or the Crohn disease, these are the acquired diseases which cause the malabsorption. Other diseases like gallbladder, liver, or the pancreas, this causes the malabsorption. And in the next slide, we see that in the parasite like helminthes or the ascariasis, this cause the villi to atrophies, and the nutrients cannot be absorbed. And when there is radiation that may injure the lining of the intestine, in the therapies like in the diagnostic tests or the x-rays, like these things, we see that there is injured lining of the intestine. And certain drugs, like we talked about before, that the tetracyclines, colchicine, and cholestyramine, these causes the injury to the lining of the intestine, due to which the nutrients are not well absorbed, and there is malabsorption syndromes. And we see the symptoms of the malabsorption in the patient. And what we see, the person who present with the malabsorption, they may have the diarrhea, the steatorrhea, we see the fats in the feces, and the abdominal bloating, the gas, and other symptoms like there is weight loss. The patient present with the weight loss, because there is less absorption of the nutrients, the diet may not be absorbed well, and the patient may present with the weight loss. And other symptoms may include the chronic diarrhea. We see that the chronic diarrhea is the most common symptom, because this may help us for the evaluation of the patients. Like we can conclude that how is the diarrhea, or the which type of diarrhea we see in the patient. Mostly there is the chronic diarrhea in the malabsorption. And what is the criteria of this steatorrhea? We collect 72-hour uh, collection of the stool, and if there is more than 7 gram per day excretion of the fats, that is the steatorrhea. And the patient with steatorrhea also is included in the malabsorption. And the patients which present with the steatorrhea, they may have the false smelling, pale, bulky, or the greasy stool. And other symptoms like when there is advanced malabsorption, we see that the vitamins and mineral several there are severe deficiency of the vitamins and minerals, and we see the when there is distal ileum or stomach rejection, there is vitamin B12 deficiency because the vitamin B12 is absorbed mostly in the distal small intestine, and when there is only mild malabsorption, we see that patient present with the iron deficiency, and in the young women, when they're present with the malabsorption like the celiac disease, they may have the amenorrhea because the in the young woman will need more the nutrients during the menses. Also, when there is less nutrients, they cannot store the menses, and we see the amenorrhea. And also, this part is ended, and in third part, I will finish this lecture with the diagnosis. Like I will talk about how to approach the patient when they present with the malabsorption. Thank you.